Namaste to one and all. Shri Gurubhyo Namaha. And today I will be dealing briefly on the common gynecological conditions which we receive in AVCRI. So before going to the gynecological condition, let us talk about the importance of women. Women are the center of creation of Mother Nature. Health of women considerably affects the health of the future generation and wellness of the family. As hormone levels vary significantly from age to age, she needs special care in her different stages of life. These hormonal variations also make females prone to stress and degeneration. For thousands of years, Ayurveda, the science of life and a way of living, is enabling women to combat these issues effectively. Why we should preserve women's health? As the slogan says, Stri Swasthya hi Kula Swasthya. That means if a healthy woman is there, the healthy family exists. Women as a seed ground, Charaga says, the yoni, the reproductive system, is a root of women. If you take the stages of women, there are four different stages they undergo, which is Rajo Darshanam, that is puberty, Garbhavastha is pregnancy, Prasava is delivery, and Rejo Nivrti is menopause. So hence Ayurveda emphasizes special care in each phase. So it is always known that prevention is better than cure. So preserve the health first, then treat the disease if needed. So these are the common gynecological conditions we receive in our OPD and IPD. PCOS, leukorrhea, fibroadenoma, uterine fibroids, adenomyosis, endometriosis, dysfunctional uterine bleeding, infertility, melasma, menopause, CA breast, CA uterus, cervicitis, vaginitis, uterine prolapse, and many more. So let us deal with all the diseases in detail. PCOS, it is very well known to each and everybody. PCOS means polycystic ovarian syndrome. So the main features are irregular or absent periods. So irregular periods can be like you may get scanty periods, you will be menstruating regularly, but the menstruation can go on for longer period. Either it can be bleeding or spotting, or sometimes in between in between 1 month you will be getting two times periods. So these can be called as irregularity. In some patients it can go for absence of periods for 3 months, 6 months, depends on their condition. There can be a lot of fertility issues, hormonal acne will be there, excess hair growth will be seen on the face and the body, and specifically you can see the blackish discoloration around the neck, and there can be weight gain, and emotional disturbances also will be there. Leukorrhea. Leukorrhea in general is called as white discharge. So there can be excessive white, yellowish or greenish vaginal discharge, foul or strong odor from the discharge. There can be itching, burning, redness in the vagina. Most of the times it is associated with back pain, and there will be burning micturition. So when you have itching, just generally don't deny that it is, generally don't come to the conclusion that it is only white discharge. In highly diabetic patient, there can be severe vaginal discharges also with severe itching. Endometriosis. So endometriosis is the endometrial lining is seen outside the uterus. And the main symptoms prevailing with this condition is pelvic pain, backache, menorrhagia, dysmenorrhea, that is painful periods, dyspareunia is painful intercourse, and infertility. Adenomyosis. In this condition, endometrium goes into the muscle wall of the uterus. the condition can be symptomized like heavy flow, painful periods, painful intercourse, infertility, chronic pelvic pain, and there will be bulky uterus or enlarged uterus. Uterine fibroids. It is a non-cancerous tumor that grow in or around the uterus. The features can be frequent urination, heavy flow, constipation, low back pain, leg pain, dyspareunia. Fibroadenoma. It is a non-cancerous breast tumor, often appearing as a solid, rubbery, movable lump, and the age criteria is 15 to 35 years of age people get this kind of problem. Mostly it will be painless. In many conditions, there will be pain, severe tenderness, inflammatory changes will be there, and it will be slowly growing in size. Dysfunctional uterine bleeding, which correlates with irregular cycles, heavy and prolonged menstrual bleeding, bleeding spotting between periods, pelvic pain, and anemia. So what does infertility means? Infertility is failure to achieve pregnancy after 12 months of unprotected sexual intercourse. Melasma. It's a very common skin condition uh, prevailing to the patients who are in their 40s, which is seen as tan or dark patches on the face, most often on the cheeks, forehead, nose, and upper lip. And menopause. Menopause is the permanent cessation of the menstruation at the end of the reproductive life due to loss of ovarian follicular activity. The main symptoms can be hot flushes, night sweats, vaginal dryness, troubles sleeping, and varying mood changes will be exhibited in such cases. CA breast. There will be change in breast size, shape, skin, dimpling or puckering, and there will be inverted nipple. There can be discharges. There can be persistent pain and tenderness because of inflammation. CA uterus, abnormal vaginal bleeding in between periods or after menopause, unusual vaginal discharge, pelvic pain or pressure or pain during intercourse. Cervicitis, it is abnormal vaginal discharge which can be yellow, white, gray, sometimes with odor, bleeding between periods or after intercourse, and there will be painful intercourse. Vaginitis. It is unusual discharge. There will be itching, irritation, redness, inflammation and burning, and there can be foul odor also. Conditions like uterine prolapse, where grade 1 and grade 2 can be effectively treated through Ayurveda. So grade 1's uterine prolapse patients represents with the following symptoms like low backache, feeling of pelvic fullness or pressure, mild pain during sexual intercourse. Grade 2, sensation of something falling out of vagina, palpable bulge near vaginal opening. Now coming to antenatal care and postnatal care. Why it is highly important to protect the pregnancy women and the post-delivery care in Ayurveda. So during pregnancy, there can be different kinds of complications like miscarriage, abortion, preeclampsia, anemia, gestational diabetes, which can be very well treated or protected with Ayurveda. Coming to antenatal care, So the first thing is ahara. Ahara means the dietary regimen. So in this condition, we advise the patient the month-wise dietary plan for nourishment. Basically, food like milk, ghee, rice, fruits, and easily digestible food are advised. Vihara, that is lifestyle. The patient has to be calm, positive, and try to be stress free if mostly possible. Adequate rest, gentle activity, and emotional stability is advised. And Aushada. So, in our hospital, what we do is we have trimester wise medicational change. In certain conditions, we do change the medicines on a monthly wise, once in 14 days and all, based on the patient's condition. So medicines like different medicated ghee, Dadimadi Gridam, Sugumara Gridam, Phalasarpis, Kalyana Gridam, Shadavariyadi Gulam. And towards the end of 7th month onwards, we'll be giving certain palkashayams that seems to have that have helped the pregnant woman uh, to deliver the baby in a better way, to keep the fetus and the mother in a better condition. And manasika paricharya, that is pleasant environment, good thoughts, emotional well-being. So what is the outcome by doing all this? By doing all this, a healthy mother gives a well-developed fetus and uncomplicated delivery will be seen. Postnatal care. Again, what is the significance in doing postnatal care? To restore normal health and strength of the mother, to balance Vata dosha, which got aggravated during delivery, to ensure proper lactation, that is Tanya Utpatti, to prevent infections and complication, to help the uterus regain its normal size and function, to maintain mental stability and emotional well-being. I would like to add one more thing to this condition. So, breastfeeding is highly important. When you do so, uh, because of the release of many hormones, the relapse, the incidence of uterine cancer, endometrial cancer, breast cancers, and all is less. So, breastfeeding has to be done until 1 year of age of the infant. So, general treatment modalities. We divide the treatment modalities into Shamana, Shodhana, and Rasayana Chikitsa. Shamana means internal medications. For all the patients, it is not mandatory uh, uh, to get admitted and do the purificatory therapy. In certain conditions, to start with preliminary treatment, the internal medications are enough. Second is Shodhana therapy. Shodhana therapy means it is purificatory therapy where we have heard about Panchakarma, right? The therapy is like therapeutic emesis, purgation, enema, and nasal treatments are advisable here. So, this is an in-house treatment where the patient has to stay here for a couple of days, do preliminary therapies like Abhyangam, Snehapanam, or Dhara Pirichal based on the condition, and then they will be posted for the Shodhana therapy. And the third is Rasayana Chikitsa. This is to prevent and to slow down the remission of the disease. So Rasayana Chikitsa basically includes internal medications, and always a lifestyle modification will be given for the patient. So to conclude with certain advices I would be giving you. So Ayurveda believes that most of the diseases occur because of your suppression of natural urges. And when you are on periods, kindly avoid exertion. And always give importance to the needs of the body, and watch what you eat. Specifically, food items like curd, maida, that is white flour, processed food, carbonated drinks, and excessive intake of non-veg can give you massive gynecological condition. And always try to have your dinner before 7 or 7:30. That way we can reduce the intensity of the diseases and the forecoming of your massive problems. And always try to follow yoga and pranayama, which is highly important for a psychological support. Thank you.